Ms. Miller-Meeks of Iowa.
Thank you, Mr. Chairman, for the opportunity to waive one to this important hearing. Dr. Cohen, it's nice to see you again, and thank you for testifying today before the subcommittee. As you know, I'm a physician, and I was the director of the Iowa Department of Public Health before coming to Congress. I've not only served in this domain, but I value it and believe that robust public health infrastructure nationwide is crucial to the health and well-being of our country. That's why I released a request for information earlier this year on how to strengthen and reform the CDC to ensure that our nation's leading public health agency is performing as it should. Part of evaluating CDC and agencies in general is realizing when mistakes are made, when programs should be eliminated or altered, and when people need to be held accountable. During the pandemic, in place of clear, reasonable guidance backed by the best scientific evidence available at the time, Americans were faced with confusing inconsistencies at best and clear bias at worst. Whether this bias under a Democrat administration was politically motivated or not, it took public health backwards. Politics aside, there is a near collective recognition that the CDC failed to execute its primary mission of protecting America from health, safety, and security threats by conducting critical science and providing health information that protects our nation against expensive and dangerous health threats and responding when these arise. This includes numerous core operational failures, as you mentioned, as well as total lapses in reliable communication. The CDC's sprawling bureaucracy of siloed and uncoordinated administrative, research, and academic programs with disease, condition, or issue-specific programs was also put on full display. The CDC was originally created in 1946 as a communicable disease center with the mission of preventing the spread of malaria, but has since grown into a massive bureaucracy with a $9 billion budget that supports research and initiatives which are not within the communicable diseases landscape. Additionally, the inability to translate research or real-world published data and evidence rapidly into public health recommendations during the pandemic was detrimental. As a result, trust in public health and faith in our public health agencies and leaders has been decimated. I don't say this lightly or with any satisfaction. Public mistrust of the CDC and healthcare professionals is not good, and it presents a multitude of challenges for the health and well-being of our nation. Unfortunately, however, the CDC has given people many reasons to not trust its recommendations, and given some of the answers you've had just in this hearing, specifically in response to Representative Palmer, it gives me pause that this failure to acknowledge certain things, infection-acquired immunity for COVID-19, its failure to communicate where the agency was getting information it was used to make decisions regarding masking, social distancing, school closure guidance, who to mask, when to get a booster, how to get a booster, even the types of adverse events and adverse outcomes and denial of adverse events and outcomes. I think, to be clear, I vaccinated. I gave vaccines in all 24 of the counties in my district. But when the CDC inserted itself between the patient and the doctor, people rightfully became wary of the agency's recommendations, which we're seeing in this current respiratory illness season now. Dr. Cohen, you didn't lead the CDC during the pandemic, but you did lead North Carolina's Department of Public Health and Human Services, where you were an ardent supporter of restrictive public health measures, such as school closures, which proved to be detrimental not only to the students' academic success, but also to their mental health and social development. Do you acknowledge that the CDC has given Americans good reason to question the agency's recommendations? And can you please highlight how the agency is working to rebuild public trust and why we should review these efforts as genuine?
Well, thank you, Representative Miller-Meeks. I do look forward to this new chapter to turn together, and I want to partner with you as we do that. So there are a lot of lessons learned from the pandemic. Nothing goes perfect in a crisis. I learned a lot of those in North Carolina. I was sharing earlier around transparency, around operational effectiveness, around partnership. So those are all things I bring to the work at CDC. I think we do need to make sure we're learning those lessons. There were mistakes related to our lab test when that first came out, so we had to put processes in place to make sure that would never happen again. We're communicating thinking differently. We're operating differently. But there's still more work to do here. But it is going to take a partnership with Congress and others to make sure that we are all moving in the same direction, that folks can feel confident in vaccines, in the treatments that can save their lives. So I look forward to working with you on that.
Well, thank you very much, but I'm just going to end with, regardless of how transparent you may be or operational excellence and relationships that you may build, if we continue to put recommendations that don't show to the public the risks and the benefits in a transparent manner, we will continue to have a lack of trust in the CDC. Our local public health nurses and doctors did not deny infection-acquired immunity as the CDC and as public health professionals who testified before Congress did, and it was embarrassing. With that, I yield.
Gentley yields back.